India's Ministry of Health confirmed its first case of Mpox in the country. A young male patient who had recently returned from a country grappling with an Mpox outbreak showed symptoms of the disease. In a statement on Monday evening, the ministry confirmed the individual as the first confirmed case of Mpox in India. In its statement, the Health Ministry said, and I'm quoting, "The previously suspected case of Mpox has been verified as a travel-related infection. Laboratory testing has confirmed the presence of Mpox virus of the West African clade 2 in the patient," quote unquote. Going on to say, quoting further, this case is an isolated case similar to the earlier 30 cases reported in India from July 2022 onwards and is not a part of the current public health emergency reported by WHO, which is regarding clade 1 of Mpox. The ministry added that. In fact, the statement further said that the Mpox patient has been isolated in a specialized hospital in New Delhi and his condition is stable and is not displaying any comorbidities. Taking caution, earlier on Monday, the ministry instructed states and union territories across the country to implement precautionary measures to prevent its spread and reduce the risk of fatalities. The health secretary has issued an advisory to local health authorities urging them to strengthen the infrastructure at public health facilities. And that's not all. The ministry directed the healthcare workers, particularly those in clinics focusing on skin conditions, sexually transmitted diseases, and the National AIDS Control Organization about the symptoms, diagnosis, isolation protocols, and treatment of Mpox. Also instructing the state officials to follow the National Center for Disease Control's updated guidelines on Mpox. These guidelines basically outline surveillance strategies, identify operational labs for testing, and suggest best practices for clinical management, infection control and prevention. Local health teams are expected to be proactive, ensuring early detection and rapid response to any emerging cases. The Central Health Ministry's advisory recommends targeted testing of suspected cases, particularly in areas with high-risk populations. This includes hospital-based surveillance and testing at the NACO's intervention sites. Early detection is seen as a critical factor in controlling the spread of the virus, and authorities are ramping up efforts to ensure that healthcare teams at international airports are prepared to screen the incoming travelers effectively. India is also stepping up its laboratory testing capabilities. As per the Ministry of Health's advisory, 35 labs being equipped to handle early diagnosis of Mpox. The country's major hospitals are reportedly readying themselves to treat Mpox patients should the need arise. The National Institute of Virology in Pune has been tasked with testing samples. In addition, the Serum Institute of India is working with the Indian Council of Medical Research to develop a vaccine for Mpox. Globally, concerns about Mpox have escalated. Last month itself, the World Health Organization declared Mpox a public health emergency of international concern, and this marks only the second time in 2 years that such an alert has been issued, highlighting the seriousness of the current outbreak. The WHO's decision followed the discovery of a new, more lethal strain of the virus. This strain, unlike earlier versions found in the Democratic Republic of Congo and other African countries, can be transmitted through sexual contact, raising new challenges for controlling its spread. Mpox infections are generally mild and self-limiting, with most cases resolving within 2 to 4 weeks with proper medical care. However, the virus is highly contagious, especially through prolonged close contact with an infected individual. Most cases reported globally involve young men with a median age of 34, and the primary mode of transmission has been sexual contact, though non-sexual transmission is also possible. Common symptoms including a rash and fever. The Mpox virus, initially detected in 1970 in the Democratic Republic of Congo, remained largely neglected until a global outbreak in 2022 brought it back into the spotlight. This year alone, over 15,600 cases and 537 deaths have been reported in Africa as the virus continues to spread. While Mpox remains a concern globally, the Indian government is taking swift action to prevent a larger outbreak within its borders. To stay up to speed with the latest news, download the WION app and subscribe to our YouTube channel.